we had created a network. We use social network like the Facebook or the Jalo. I have many friends in Kamau, and when the patient go back to the home, check the photo. All my patient have my phone number. My friend check the photo, send it to me. They had a network. I had a group in Jalo over 600,000 around Vietnam.
Hello and welcome to the Demystifying Healthcare in Vietnam podcast. I'm Beth Ann Lopez, founder and CEO of Docosan. We're on a mission to make getting healthcare effortless and bringing you insights from Vietnam's top players in healthcare. On this week's episode, we're speaking with Dr. Nguyen Duong Phi. He's a pediatric orthopedic surgeon practicing at the City Children's Hospital in Ho Chi Minh City. He received his doctoral degree in medicine from Pham Thach University of Medicine and completed postgraduate studies in places including the U.S., like at University of Texas's Shriner Children's Hospital and Loyola University's health system. So, Dr. Phi, it is really great to be here with you today, and we're going to discuss orthopedics in Vietnam.
Okay.
And so, getting started, what are orthopedics?
The orthopedic surgery is the specialized medical field that deals with the musculoskeletal problem, like the trauma and the congenital deformity that involve the joint, the bone, the tendon, and the muscle of the whole body. That is orthopedic.
Okay, I see. And then what was your path into becoming an orthopedic surgeon?
Well, when I was young, very, very young, I was caught with a very severe disease, the dengue fever. And why I experienced the near-death experience. And then the doctor, the whole staff, the nurse saved my life. So that when I was 7 years old, I decided to become a doctor. And now I fulfill my dream. And then at first, I want to become the pediatric, internal medicine. But in my third year, there were the case of the dislocation of the scapula, and my mentor told me to join him to reduce the zone, and then we successful in reduce the zone, and then he told me that I should become an orthopedic because I am strong. I can do the orthopedic surgery, but then I think I need to choose between the pediatric and the orthopedic surgery, but I think I will do both of it. And I become the pediatric orthopedic surgeon now. I fulfill my dream.
I see. And so I guess orthopedic surgery is different from other types of surgery in that you actually have to have a bit more strength because you're moving bones, right?
Yeah, because we do the fracture. We must use the strength to reduce the fracture. Some of the fracture are very easy to fix, like the forearm. But when the femur of the over 100 kilogram patient, so we hit we need to have strength to do the fixation.
I see. And I know that you're specialized in pediatric orthopedic surgery in particular. And so why did you want to focus on children? And I guess also, how is pediatric orthopedic surgery different from that in adults?
Yeah, because the children is very susceptible to fracture, and they tend to get the injury. But the orthopedic is not only about the trauma. But I love to do the congenital deformity of the children because I think the deformity, if I can change the deformity, like the syndactyly, that means that your fingers on together, or the children had the extra digit. So if I can help them, this will be the big game changer. I can help them to improve the life quality. So I choose to become the pediatric orthopedic, so I can do it to help them.
Yeah, I see. That must be a huge impact for the rest of the kid's life,
being
able to live normally. What are some of the most common congenital orthopedic issues in children here?
Oh, in Vietnam, that a lot of the children have the syndactyly or the polydactyly, the extra finger, or some had the radial dysplasia. That means that we had the two bones in the forearm, the ulna and the radius. But the children with the congenital deformity that don't have the radius, so this is hard for them to move the finger, and this hand become deformity. It's the deviation of the radial, and when they grow up, they cannot grab the thing or do anything. So it's very bad, and we will try to improve it. This is the priority of our team to deal with the congenital deformity.
I see. And so what is the state of pediatric orthopedic surgery in Vietnam if you had to describe it as a whole?
But I think that the pediatric orthopedic in Vietnam now did not enough attention because a lot of orthopedic doctors tend to do the adult. They do the reconstructive like the joint replacement or the arthroscopy because they can make money from because the arthroscopy or the joint replacement that had the instrument. So this they can really see a lot more, and they can support the family. Not a lot of doctor to the pediatric orthopedic because we don't have a lot of instrument. I work at the pediatric orthopedic, but it's not enough to support the family. So I not work only in the children hospital. What I work some of the private hospital to support my family.
I see. Yeah. So I guess that's something that's a bit unique in Vietnam is that often doctors have multiple jobs that they have to
multiple
do. So part-time in the public hospital and part in the private. And so like what are common salaries, I guess, for surgeons or general doctors in the public hospital, if you don't mind me asking?
Okay, I can say that. My salary in the public hospital about 9 million Vietnam dong. And 9 million Vietnam dong per month. That means about nearly $500 US for 1 month in the public hospital.
And how many years of medical school and training did you have to go through?
In Vietnam, to become a doctor after graduate from the high school, I must check 6 years in medical university, and then I check 2 years of the specialty level 1 of orthopedic, and then 2 years of specialty level 2 of orthopedic. It takes about 10 years to become an orthopedic surgeon in Vietnam. 10 years.
10 years. And so, man, that's pretty incredible. So you have got 10 years of specialized training, but then unfortunately the public salaries do not reflect the degree of like skill and training.
This is the most common problem in Vietnam.
And you also mentioned that I guess like in the kids, there's less of like profit that you can get from like joint replacements and stuff too, right? Are there socioeconomic differences between your typical pediatric patient versus like an older person coming in?
Yeah, that the profit is different from the pediatric and the adult because I think if we do the orthopedic surgery on the adult, we make more money than the children, a lot more. So not a lot of doctor to the pediatric orthopedic.
Okay.
Or the pediatric general surgery too. I think.
I see. So I guess the doctors who go into your specialty must be very impact motivated.
Yeah.
Yeah. Okay. And so what is postoperative care like in Vietnam?
I think I work in the US for 2 months, and I think that the postoperative care of the children with orthopedic surgery is the same. The Vietnamese doctor is very skillful and they read a lot of textbook. We can access the resource on the internet. The care is the same, but it is very hard for the children from the countryside, very, very far away, the rural area, to come to the big city and then do operate and then return to the home very far. So it's hard to care for them very fast. So they must go to the hospital near the home.
I see. But what for, I guess, more intensive surgeries for the patients that have a bigger issue, maybe there's no hospital that can treat them in the countryside. So then they come to Ho Chi Minh. Yeah. So how can you guys support the patients when they have to go back to the countryside?
So this is one, we have created a network. We use social network like the Facebook or the Zalo or the WhatsApp. I have many friends in Cà Mau, in Tinsan. And then when the patient go back to the home, I will call my colleague. And then when they change the dressing, the wound, take the photo, send it to me. All my patients have my phone number. But if they cannot use the phone number, they can go to my friend. And then my friend take the photo, send it to me. They have the network.
Oh, wow. So you guys are basically doing telemedicine between doctors
and
supporting each other.
I had a group in Salo over 600 surgeons around Vietnam.
Wow. And so what do you guys commonly, so other than supporting patients when they go out back post-operative care, what else do you guys use those groups for?
When we had a difficult case, we must have a discussion with each other, like, the cancer, the bone cancer, the very, very terrible. So very few hospitals in Vietnam that deal with the bone cancer. We need to know that the sarcoma. So we had a difficult case. We will rise, we will on the salon or the fiber, and then the expert in the field, the oncology, orthopedic come in and then discuss how to deal with it, how to surgery and make a team.
Okay, that's quite amazing, because usually when we think about healthcare, sometimes in Vietnam, we talk about fragmentation, the hospitals being separate, the clinics being separate, the doctors all over. But you guys have found an innovative way of connecting with each other.
Yes, because many years ago, my mentor saw this problem. The doctor, we not like in the US, we not talk with each other, we not communicate with each other. The children from the countryside go to Ho Chi Minh City, so go back, what happened with them? Then we ask the doctor, we don't know. I don't know about the patient that I do the surgery on. What about the wound? What about the bone? Will they heal? Oh, don't know.
We don't hear back about it.
Yeah, but I think that the doctor, the orthopedic surgeon, must have the responsibility on the patient. I or the doctor do the operation. We must do the both care, the both operation care. So we are doctor, not the surgeon. The doctor means that we must re-operative, on the operative, and both operative. The doctor, not the surgeon. The surgeon only do the operative.
I see. So then you actually have multiple roles too. So it's not just focusing only on the surgery, but
not on the surgery.
Pre-operative, post-operative. You're involved with the whole, I guess, like journey of the patient.
Yeah, the journey. And then remove the hardware. Because the orthopedic with that, if the child had a fracture, we must fit the fracture by the internal instrument. We put the blade or the pin inside, and then we must remove it out. And I think we must work as a team. The orthopedic doctor only do the surgery. But what about the rehab? So we must have our team must have the rehab doctor too. And then we talk with each other, communicate with each other, and maybe bring the best result for the children and for the patient. So we had a group on Zalo too, over 600 doctors in Vietnam. But only a year ago. But I am not the one who will create the group. My mentor did it.
Wow, that is so interesting. And then, so you also mentioned coordinating with rehab doctors. What is rehab typically like in Vietnam? You have experience in the US. How does it differ, if anything? And then also, are there enough rehab doctors here?
Oh, we don't have. On my hospital, the City Children's Hospital, very big hospital, only 2 rehab doctors. Only two. We have 8 orthopedic doctor, but only 2 rehab doctor. But rehab is very, very useful and very, very important. We do the implant, we fit the bone. But if the child don't do the rehab, then we had a step on the zone. It is not good. When we separate the finger in the syndactyly, if they don't do the rehab, if we have a stiff finger, they cannot move or wrap anything. The rehab is very, very important in the US. I was in the US for 2 months, but I think that the rehab don't get enough attention in Vietnam. Not many doctors choose the rehab because they think that they are not the main character. The surgeon is the main character, not the rehab. But in the US, the same, doing at the same level. The orthopedic surgeon is not the boss. We are colleagues. We are not the boss.
Right. Interesting. So there's almost like a difference in prestige or hierarchy between kind of like rehab doctors and the surgeons in Vietnam. But I know medicine is hierarchical kind of all over the world, but it's interesting.
I think the main point is that we talk and communicate with each other. We respect each other.
That is really great. And then can you tell me a story about a patient that like really stands out in your mind that you've been able to help?
Yeah, I have many stories, but about the orthopedic story, I think I know about from a very, very far, a very rural area. His name Ching. He had club feet. You know club feet?
Yeah.
Yeah, he cannot walk. And he's very poor. to do the medical surgery. So when my mentor, one of my mentor, Dr. Thonchan, Professor Thonchan from Australia, came here and find the boy. And then we communicate with each other. And then we communicate with the charity group. And then we send him. Well, in Vietnam, we don't have the instrument to do the surgery. We send him to the Australia and do surgery on the Australia.
Oh, really?
Yeah. We do the surgery on the in the country in the Australia, and the boy he can stand now. And one of my charity group leader, Miss Myvi, adopt him.
Oh, really?
Yeah, he had a mother now.
Oh,
yeah, he can walk now, and he can go to school.
Yeah, so you guys completely changed his life. Like he wasn't able to walk, and then now he's got a whole family.
He had a whole family. He can study, and then I think his future will be better.
Yeah, and so he's from a poor family in the countryside, and so was it that the type of surgery is not available in Vietnam, or how come he had to go to Australia?
We don't have enough instrument in Vietnam because you know that in club fit, if we treat it early. When you were born, we don't need to do the surgery. Just do the casting. Do not rush retrieve and do the casting, the plaster cut, retrieve it and change the cut. But this is early. But the point that the neck neglect the club fit. So 5 or 6 years old, very very old for the treatment. So in Vietnam, we cannot do the treatment. We don't not have the right instrument. So he must go to the Australia. But I think we succeed because we had a team, the charity group, the doctor, the nurse, and our mentor from Australia. A lot of paperwork to do, but we succeed.
Yeah. And how did you guys identify this patient? So if he's living out in the countryside, how did you even know about his case?
One of my friends go to the countryside and found it, and he alerted that there is a boy that needs our help. So she called my mentor, called me. We called the professor from Australia. He used the telemedicine. Like, I will come to Vietnam to see him. I will come, and he came. He will come this September too. Says, hey, Dr. Thonchan not only do with the congenital deformity, but the CP, cerebral palsy. He will come here in September to help cerebral palsy children in hospital for trauma and orthopedic in the District 9, and he will come to my hospital too. He come here every year to help born children.
Okay, so that is really cool. So the doctors kind of came together. You guys found this particular case. You identified what you could do in Vietnam, used new tech to connect him with this doctor in Australia.
Yeah.
He ended up getting treated. But I mean, really, that was kind of like because of the care you guys could have just walked past or said, oh, he's too poor, we can't do anything. But you really went out of your way to help this patient.
Yeah. And some other patients too. But if we talk about it later, a lot of case.
So I guess it must be fairly rewarding for you. That must be kind of what keeps you going.
Yeah,
that sounds like
the rewarding is the emotion. Very emotion. I think that if the boy has a family, he can learn, he can study. I think about my case, I was saved by the doctor and I became a doctor. I fulfill my dream of become a doctor. So now I will fulfill another child dream.
I see. Well, it's something that impacted you for your whole life.
Yeah.
And so when you were a kid and you got dengue, what happened with that? How did your family know that it was dengue, and when did they know to take you to the hospital?
Oh, I had a fever, very high fever, over 39 degrees. And then they took me to the hospital. And then the nurse and the doctor took my blood. He had dengue fever. He must admit to the hospital. And I was in the children's hospital number 2 for over 1 week.
Oh wow! Yeah. And then now you're practicing at another children's hospital.
Yeah.
In the same place, full circle. Okay. And so in dealing with children in particular, how do you navigate cultural sensitivities and effectively communicate with both the child and the parent and deal with some of the psychological aspects of that?
The key factor is always listen to the caretaker. Only believe the mother, the father. We must hear what they need to say and trust them. And then we must find the rub, because I think that the mother or the father always love the child. So just listen to him and find out what they want. And that we, not the doctor, treat the child, but we, the team, the doctor, the parent, we are in it together to care the child, to care the children, because we are one, and that this is the key factor. I think it is, in my opinion.
Okay, I see. So you really try to involve the whole family in the decision-making process and the care. Yeah. Is there any sort of intersection between mental health and especially maybe like the recovery period and anything that you have to deal with for that?
Yeah, I think when I had case with I lack of experience, I will ask my mentor, and then we will after rehab. I think it is very complicated process, not only the doctor.
Yeah, I see. But you involve other doctors too.
Yeah, involve the doctor too.
Basically come up with the whole care team.
Yeah, the whole care team. But I think we are not as good as another country like the US. But I think we are getting better because many young doctors go to the foreign and study, and they come back, they see what to do. And then we have a team now. I think it is different now, and not we are not working at one individual, but we work as a team to care for the children, especially the oncology patient.
I see. Yeah, I find that so interesting about Vietnam is that like there's so many doctors and professional people who study abroad, go and they come back. It's a little bit different from other countries because we see in Philippines you have people that study abroad and they never come back. But why is it that you think that so many like Vietnamese study abroad but then actually come back to serve in their country?
In my opinion, that's because Vietnamese people love the country. We experienced many war in the past with our neighbor, the Chinese or the US or the French. But I think that us Vietnamese love the country. Okay, so they come back to serve the country. But I think people may think different. A lot of doctors go and never come back too, like in the Philippines. But I think most of Vietnamese doctors will come back.
Yeah, and that's such a huge resource for Vietnam too, to be able to take advantage of other kind of medical education systems, bring new techniques and practices back.
Yeah.
And then I see that playing out quite interestingly, like when you're talking about this big Zalo group of 600 doctors that are here and supporting each other. I've never heard of that somewhere else.
I can show you my group.
Yeah, I think that's fascinating. And then it's you guys have found your own kind of way of dealing with the fragmentation of the health system, right? Yeah. The doctors have come together. Yeah,
we did my mentor idea after he came back from the US. Man, I think only 1 or 2 years ago. We don't have a group before that, but he made it.
Okay. I see. And so what are your hopes and aspirations for the future of pediatric orthopedics in Vietnam?
Yeah, I had the dream that all the children can have the best care for the problem of pediatric orthopedic, and we can treat him regardless of the ability to pay or not. Yeah, like in the US, all the children have the right to be treated. You know, the China hospital. The China hospital can treat the patient regardless ability to pay or not. And I love to see it in the future. Vietnam has that kind of hospital or the health system that help the children, because the children is the future of the country. I think we must invest on the education and the healthcare system.
Absolutely. Yeah, that is something that is quite different from the US and Vietnam is that in the US, you do have a lot of not-for-profit hospitals and a lot of like charities. And even the not-for-profit hospitals, they still, they say they're not-for-profit, but they're not for loss. Versus in Vietnam, the private hospitals are very private, like
very costly.
Very costly, yeah. And not a lot of insurance.
I work in the American International Hospital too.
Oh, okay.
Yeah.
Yeah. No, I think like very nice equipment and everything too, but it's if you can't afford it, then it's difficult. Okay. So are there any new technologies that you're particularly excited about in orthopedic surgery?
I think when I in the US, they had the very nice system at the tissue bank. You know the tissue bank?
I don't know about tissue banks. Can you? What is a tissue bank for?
Yeah. The people can donate the skin or the organ like the heart or the liver after that. And in Vietnam, we only had the cadaver bone from the dead people. But in the US, we had a lot of kind of this. I think that in Vietnam, we can try to improve it. Because if we have something to substitute for the tissue, it's good than check our tissue. Like in anterior ligament of the knee, in Vietnam, we check the autograft. That means we check another ligament from the patient. But in the US, we check the ligament from the dead people.
Huh.
Yeah.
Interesting. So they actually have like whole tissue banks. Yeah. I maybe for any investors in the audience listening to this, this would be something quite interesting to bring here, tissue banking.
Yeah, tissue bank. The tissue bank in Vietnam, we don't have any kind of tendon, ligament, or muscle. That's the point.
Yeah, I see. That was super interesting. Well, that wraps up my question. So thank you so much for sharing your perspective, Dr. Phi. It's so interesting. And our listeners can find Dr. Phi on Facebook as well as on Docosan. Links in the description. So thanks for listening and catch you later on the next episode of Demystifying Healthcare in Vietnam.